Shukran. It's amazing to be back here in UAE. This is my third time visiting the Emirates. Last time was about a year and a half ago, meeting with on Banias Island and having an opportunity to speak to the cabinet. And in this hour, what I'd like to do is help explore a little bit about the cutting edge and the future of health and medicine and how that relates to you individually, for your cities, for your governments, and for your nations. This is just a couple pictures of my first visit here. So I had some interesting experiences in the dunes and a very magical and special place. Okay, so before we look into the future, I thought we'd look a little bit back to the future. My training is in medicine. I went to medical school at Stanford and then did my training in Boston at the Massachusetts General Hospital. And I had a chance to go back there recently for the 200th anniversary of MGH. It was a chance to get back together with the men and women that I trained with. And if you go back to visit Mass General in Boston, you can visit one of the most historic places of medical history. And it's in the old original building, and it's called the Ether Dome. And it's called the Ether Dome because over 150 years ago, in 1846, this patient in this very picture was the first patient to get general anesthesia with surgery. It's like before that, they used to have to do the surgery without any pain meds. And so that is a very historic place. It was the first time this innovation happened. And if you go to visit the Ether Dome today, it's a shrine to history. It's sort of frozen in time. It looks just like it did in 1846. I wandered down the hall about 4 minutes away to the ward where I spent my first month as a brand new doctor in 1996. And to my shock and dismay, that was actually also frozen in time. It looked pretty much like it did almost 20 years ago. The same alarms were beeping, some of the same nurses, some of the same patients. The only difference was the poor doctor on call was using a computer now to write the medical records and print it out and put it in the paper chart. And the front desk was still using the cutting-edge medical technology we use around the world today, the fax machine. So my thought was, even at a very top-tier medical institution like Massachusetts General Hospital, healthcare and medicine is still being practiced in many ways like it's been done since 1846 for hundreds of years, based on old silos, old definitions and ways of thinking about health and medicine, where the standard model is, wait in the waiting room for 30 minutes for your doctor to see you, and then the doctor tells you what to do. But we're now in this amazing new age, this connected age, this genetic age. We can think outside of the usual body parts and specialties in new ways, especially if we're going to reinvent and rethink healthcare here in UAE and beyond. Because whichever government you're coming from, the United States government where I come from, or here in the UAE or beyond, we have many challenges in health and medicine. Some are the rising costs. Some are the aging demographics, and how do we take care of our older population? Access to care. Not everyone lives in Abu Dhabi or Dubai. In many rural parts of the country and the region, it's very hard to get a physician or communication. We're in an era of big data. I don't think you're surprised to know about all the new information coming at us. A lot of that is not useful until it could become something we can use in our hands as a patient, as a consumer, as a physician, as a member of government. And because much of that data is fragmented between different medical systems, different medical records, there's a lot of waste and inefficiencies. And of course, particularly where government plays a role, we have a lot of amazing technologies. Many of them are next door in the museum. Some of them I'll show you in this presentation. It still depends on how the government set up the incentives, the regulation, and how you pay for these new technologies to help them get out into the world. So if you think about our healthcare systems in most parts of the world, they're really not healthcare, they're really sick care systems. They're very much based on two models where it's intermittent and reactive. I say intermittent, meaning the data that we get from our own bodies, the way we communicate to our physicians and nurses is very scattered. We only get that every time we might go to the hospital or the clinic. And our systems are very reactive, meaning we wait until the diabetes happens, or the stroke, or the heart attack, or the lump is discovered. And I think with technology and new thinking, as we're seeing at this conference, we can shift from intermittent and reactive to more continuous and proactive. So before we talk about technology, let's make sure we know a little bit about the incentives. In most parts of the world, physicians like myself are paid not a salary, but every patient we see, or every procedure we do, we're on the right side of this equation, spending most of our healthcare dollars on folks who already have chronic and acute diseases. That's sort of incentive-based medicine as opposed to evidence-based medicine. But in many parts of the world, things are shifting to the left to start rewarding value and health and prevention. And I think here in Dubai and Abu Dhabi and UAE and beyond, there's a great potential to shift the equation from the sick care to the healthcare side of the equation. And also shift, where does healthcare happen? You know, traditionally happens in our hospitals and our clinics and intensive care units, but technology is taking healthcare outside of the hospital into our homes and onto our own bodies and into our smartphones. And we'll talk about that progression and where that's heading and some of what that means for the future. So when we think about the future, and it's so amazing to see what's developed here in the Emirates, it's often useful to look back a little ways to see how quickly the world is moving. You know, it was only about 12, 15 years ago that I came back to Stanford to do specialty training in cancer care, oncology. And that was the same year that the iPod came out. That was only 2001. That seems like a long time ago, but it was only 2001. And that kind of thinking, remember Apple, and we'll hear from the co-founder of Apple later today, they didn't invent MP3 players or music, but they put it together in a new, delightful way. And we're seeing technologies like our smartphones and our iPods get smaller and smaller. The iMac of 2000 now fits on your iPhone and soon will fit on your Apple iWatch. And that's an example of technologies moving on an exponential, meaning with Moore's law, the power of computation in your mobile smart devices is about 1 billion times faster and cheaper than the best supercomputers at MIT in 1970s. And you need to be thinking exponentially. How does technology double year on year in many fields, not just computation, but many fields that are coming together and moving quickly? And not any one technology, it's where they layer up and converge. That's the magical point, where things get faster, cheaper, smaller, and better, where we have the opportunity to reinvent. And just a few examples of reinvention you've all seen. We've reinvented how we read, you know, on things like Kindle. We've reinvented photography. We've reinvented how we see our movies. And that means major companies have gone bust. We've seen new companies like Uber, only a 4-year-old company, now worth $40 billion. They're all over the world, even here in Dubai. And if you think about it, they did not invent any of their technology. They didn't invent the smartphone, maps, GPS, online payments. They put it together in smart ways, and now you can use it in many parts of the world, except for some parts of Europe where they're having strikes against it. So new technology often has people who are against it when it disrupts their own business model. But that sort of thinking, this Uberification, is coming to healthcare. In fact, I used Twitter to say, who is building the Uber of healthcare? And 3 companies said they're already building it. You can be in New York City, press a button on your mobile app, and a doctor will come to your home within 3 hours. I'm not sure what kind of doctor, but you'll get a doctor. And you get to rate them, and they get to rate you. And even Uber themselves did a pilot called Uber Health, where on the same application as the car service, you could go to Uber Health, press a button, and a nurse would come to you and give you your flu vaccine. So that kind of thinking and the new digital generation is getting used to having access, having insight, having the payments taken care of beforehand. And I think we're going to see that happen in healthcare. And if you're not thinking exponentially, you know, you could be the next Kodak. Kodak invented digital photography, but they didn't really pay attention to how it was emerging. And what happened 2 years ago? They were bankrupt, and 12 kids down the street from me in Palo Alto had sold their company for $1 billion to Facebook, Instagram. So it's that kind of thinking that I think all of you need in healthcare and beyond if you want to be the disruptor, not the disruptee. Okay, let's look at some examples of exponential technologies in healthcare. One of them is human genomics. You know, it was only about 12 years ago that the first human genome was sequenced. It took several years, tens of millions of dollars, but the price and speed of sequencing, understanding the code from your own DNA, has now dropped at twice the rate of Moore's law, to the point where it's only about $1,000 today. In a few years, will only be $100. In fact, today you can send a cheek swab, a little saliva in the mail, and for $100 US have millions of bases of your DNA analyzed. And that can be really, really important for understanding your risks, for understanding how different drugs might affect you or your family. The challenge is, as an individual, as a government, as a consumer, what happens when you have your genome on a disk drive? What do you do with that? How do you make sense of that as a doctor, as a researcher? We're learning how to make sense of this information in new and powerful ways. Now, of course, it's not just the genome that's getting cheaper and more accessible. It's the proteome, the biomarkers from our blood. It's environmental data. If you grew up, you know, in the desert or in New York City, you have very different exposures and risk factors than if you lived by a nuclear power plant, for example. We're understanding the microbiome. It turns out that we have over 10 times as number of cells in our body that are bacteria living inside our GI system that have a huge impact on our health. They play a role in obesity, in diabetes, in cancer, and we're learning to sequence the microbiome and even use that for therapy. So a whole new area, all these new ohms are opening up, and is bringing us to an era of personalized medicine and precision medicine that we can use going forward. This is starting to blend with the high-speed imaging and world of radiology. You can now take a pretty standard X-ray or CT scan and reconstruct that on your tablet. And this gives the surgeon, the patient, much more understanding of what's happening with their specific anatomy and how to more specifically and personally treat that individual patient. So that's one example of exponentials, high-speed computing, high-speed imagery. It's blending with neuroscience now. We can not only image the brain and understand its amazing anatomy, but also how it is wired, the connectome. How are your pieces connected? How does that play a role in everything from autism to Parkinson's disease to psychiatric disorders? And we're learning to be more proactive. If you can take your brain and image that brain, instead of waiting until a patient might develop Alzheimer's disease, for example, we can tell on certain scans 10 years or sometimes 20 years before that patient's likely to develop the disease. So we have an opportunity to then treat it early and maybe move to prevention. Other forms of diagnostics are moving exponentially. I think you all know the heart cardiogram, angiogram. That's a way of diagnosing blood vessels. That takes a catheter and a catheter in your heart and dye. Now that is being disrupted by new technology from Stanford called HeartFlow. You can do a 30-second scan of your heart, send that to the cloud, and computationally discover, is your blood vessel narrowed or not? How narrow? Do you need a cardiac bypass surgery, or maybe you might need a stent? And what kind of stent will you need based on that imagery? So in the future, I think we'll be diagnosing most cardiac disease not with a cardiac catheter, but with imagery. And in some cases, we might even 3D print the stent that matches your own personal anatomy. One other example would be the ultrasound, replacing that with a very short MRI scan. Now we can see not only the amazing anatomy, but all the functions of the heart, how well it's squeezing, if there are leaks. And I think this will be another way of doing fast, rapid, and highly efficient and lower cost diagnosis for the heart. So a lot of these exponential technologies, live in the hospital. But of course, they're actually coming to ourselves, our hands, our homes. And the most obvious one we're most familiar with is the smartphone. 10, 12 years ago, we just had the Palm Pilot. Now we're in the era of the iPhone, the tablet. Every medical student at Stanford, where I'm based, now gets a tablet their first day of school, an iPhone or an iPad with their entire curriculum on the tablet. Now, if you go to India and other parts of the world, there are $35 tablets being sold. So while they're not the fastest tablet on the market, in a few years they will be as fast as today's iPods and iPads and Samsung Galaxies. How could you use those for education, for public health, and for medicine? Because the millions of dollars of technology that used to be separate are now disappearing and dissolving into our mobile devices. And these mobile devices are becoming healthcare platforms. Google is about to launch a modular smartphone called the Aura. You might have a different fragment that you might put in for heart disease or emphysema. And speaking of diabetes, which is a big issue in this part of the world, there are new tools for patients to become really the owners of their health information. One of the big trends is that the future of medicine belongs to the consumer, to the patient, where they become the CEO of their own health. As a diabetic, if you can record your blood sugar on your smartphone, share that in the cloud, or there's other technologies now where you can wear a patch that records your blood sugar 24/7 and understand your data, have a dashboard, share that with your medical team, you can be much more effective in lowering your blood sugars and being healthier. In fact, in the United States, 3 months ago, was the first FDA-approved app for diabetes that's now being paid for by many of the insurance companies. And they've been able to show it dramatically can lower blood sugar. Another company recently launched something called Livongo. It's a glucometer, but also has a social network. It has your step counter. It integrates all this information in something you have in your own pocket as a diabetic to stay connected and to make diabetes easier to treat and manage. So part of the future of medicine is prescribing apps and devices as opposed to just drugs and surgeries. So we're going to see a big explosion of this combination of games, mobile, and apps. Now we know incentives are important, and sometimes healthcare can be a little bit fun. We can incentivize folks to use new technologies like Microsoft Connect to do their physical therapy, or if any of you visited the Future Museum, there's a game where you're using a ball and moving around, it tracks your vital signs and your exercise. That kind of off-the-shelf technology is being used for both physical therapy, for exercise, and by surgeons in the operating room to manipulate images. So many ways to take existing technologies and integrate them into healthcare. And a lot of this is being termed digital health or mobile health. The fact that all these technologies that used to be on paper, hard to access, are becoming digitized to the point where we can have most of these in our pocket. So for example, on the upper right, a technology from MIT can do eye exams, and they're taking that to India where there are very few eye doctors. Or if you don't have a dermatologist, a skin doctor, you can take a picture with the app and it can do a diagnosis. Or if your child has an ear infection, you can look in their ear with an otoscope. And one of my favorite examples is in the cardiac world. There are now low-cost devices. I have one in my pocket that I can just put with my smartphone, and it's going to do my EKG in real time. So this technology is now FDA approved. It's being sold for about $40. And in real time here, I can do my EKG. So if I had a cardiac issue, this might be helpful to have to send to my cardiologist. But this is also useful as a screening tool, for example. We could pass this around the room, and we might find some of you have a cardiac issue who doesn't know about it. And because many doctors and patients aren't good at reading EKGs, you can press a button on the app and have it sent to a cardiologist who will do the interpretation. Or soon, artificial intelligence agents will read your EKGs for you. So that's just one example of a low-cost technology coming to our pockets that can be used for almost any cardiac patient. A lot of this mobile digital health has come out of a new movement, a consumer movement called quantified self. How many of you have used a Fitbit or anything like that, a tracking device? I'm wearing like 4 of them right now, right? That's too many. Very sure you have them. There's an explosion of these wearable devices. I was at the Consumer Electronics Show, CES, this year again, and there was 100 more of these. But what's interesting is these are moving from quantified self, kind of track your steps and your sleep, to more quantified health. For example, there are now watches that detect your heart rate. If they can detect your heart rate, you could prescribe this to a patient with heart disease. Or the new Apple Watch that will come out will track your activity and your heart condition. And as we're seeing, there are even fun technologies like a connected fork that can track your eating. Now, you may not want to have this, but it might be useful for insights. Or very basic technologies like a blood pressure cuff are now connected to the cloud and can help you understand your high blood pressure or those of a whole set of patients with hypertension. What's getting interesting is the Googles and the Apples and the Facebooks and the Samsungs of the world are now taking this technology that might live on our wrist or a connected scale or blood pressure cuff, and they're connecting it to our smart devices. And that's soon connecting with our doctors and medical systems. And I think here in the UAE and beyond, that's going to be a very powerful way if you're a diabetic or have heart disease or emphysema or just trying to stay healthy to integrate that data and share it in a seamless, smart way. It's coming to our children. This is a picture of my son wearing a connected onesie that can track his vital signs. It's coming to our pets. It's coming in interesting ways. Even the future of connected diapers is actually already here. A company called TweetPea has made technology that can let you know what's happening. So lots of opportunity there. The challenge is, how do we put it all together? Because no one wants to wear all these devices on their wrist every day. I think we're going to see these disappear into wearable tattoos that you can be sent home with that can stay on for a month, onto devices that, like a patch I'm wearing right now. I'm wearing right now a disposable cardiac patch underneath my shirt. It's in one of my pockets. This patch is going to be $2 a day. It's about to go on the market. And right now it is streaming my vital signs directly from my phone to the cloud. So I get an immense amount of information just from a little wearable patch. I'll show you a picture of the data here. And that is going to be very useful for sending folks home from the hospital, monitoring outside the normal environment. But it's a lot of data. We still need help interpreting that and making sense of it as we go. You can log into my vital signs anywhere you have a web connection. And again, these are disappearing into contact lenses. Google, of all companies, has developed a contact lens that can measure blood sugar, and they're partnering with a big pharma company, Novartis, to take this into the diabetes space. There are pills that you can swallow now that will take pictures of your GI tract instead of having an endoscopy, a camera that goes down. So lots of things are getting smaller and moving inside of our bodies. The opportunity then, as a physician, is to prescribe you apps and devices. I may say, you know, here I'm prescribing you exercise. I want to see how you're going to do. That can help set your incentives and changes going forward. Now, health and medicine isn't just about our vital signs. It's also about our laboratory data and understanding what's happening inside our bodies. There's a whole new world of connected, low power, very high efficiency labs on a chip, bringing the clinic to you. There's many examples of this. Some of them can be done, you know, right at the point of care. For example, urinalysis, dipping your urine and analyzing it. Now there's technologies like this one where you dip it in the urine and your app takes a picture of it and reports the results. So no kind of trying to figure out what's happening by eye, very objective, and can send this information to you, to your hospital, to your medical system. Or if you're concerned about influenza or infectious disease, you might spit in this little tube on the right, and it is going to diagnose everything from common flu to potentially Ebola, right? So we need these technologies to start, in some cases, democratizing how we can do laboratory testing anywhere in the world. In fact, Harvard just developed a saliva-based test on paper that can screen for Ebola. And we know in the fast-paced connected world today, we need new tools to screen and prevent and monitor disease as it happens. This morning, and what this brings us is this idea of a digital checkup from anywhere. You don't need to be going to the doctor to have your blood tested or to have your vital signs done. You don't need to visit the doctor face-to-face. There's now a whole new generation of connected applications for doing telemedicine, where you can press a button and be connected to your physician or your nurse and have a high degree of information that can be very useful anywhere you are on the planet. And that will bring us to an era where the elderly can age in place, where we can be smarter about leveraging this technology not to replace the doctor, but to augment our skills and to be more smart and connected with our patients. Now, the challenge with all these technologies, many of them are here at the conference, is that they're layering. It's no one technology. And when you layer technologies and they move quickly, sometimes this goes faster than governments and policy can keep up with. For example, there are now pacemakers, very small ones, easy to put in the patient, that are connected. They have internet connections and they have applications, which means also they can be hacked. What happens when someone hacks your pacemaker or your insulin pump, or takes your DNA and publishes it online? Or if you have an implanted device, like my friend here, Hugo, what happens if the company who makes that device won't give you your own data? Who owns the data from our bodies, our own DNA? Very interesting privacy issues we need to pay attention to. And then, how do we make sense of this information as an individual, as a consumer, as a policymaker? It's too much data. The new papers coming out every day are impossible for any one physician to read. So we need new tools. We heard this morning a session from IBM Watson's leader, and IBM Watson is a great example of now using artificial intelligence in healthcare. And I actually like to call it not artificial intelligence, but intelligence augmentation, because it's not going to replace doctors, but it's going to help us be smarter about taking all this new big data and making it useful for you as a patient or for you as a policymaker. And there's many examples, some of you heard this morning, about how Watson can be used for a diagnosis, for helping choose the right therapy. We've seen that Watson has now gone into Africa to help track the spread of Ebola. So many powerful ways we can integrate this new exponential world by using technologies like artificial intelligence. So where does this all come together? How do you make sense of this? I think part of the future will be kind of like your modern car. The new IBM, the new Porsche or Mercedes has 200 or 300 sensors in it. You don't want to look at every sensor. You care about when your check engine light goes on, your own personal check engine light that's in an integration of lots of information. So I think the future of our health will be this integration of data, kind of an OnStar for the body that's going to learn you and be a personal GPS to guide your healthcare. And it's becoming like science fiction. Some of you might remember Star Trek, and they had a device called the medical tricorder. It would scan the patient. Well, now there are $2,000 scanners that are ultrasounds that fit in your pocket. So that's not science fiction. But where this is coming together is to blend artificial intelligence, mobile, and data in a smart way. And Qualcomm, they make the chip, joined together with the X Prize, and many of you may have heard Peter Diamandis here last year talk about the X Prize, to make a prize to build a home-based tricorder. And over 400 teams entered this competition. One of them started at Singularity University, where I chair the medicine track, and they have built already a medical tricorder. This is a working version of a device that when I hold it to my forehead, it will actually look at my heart rate, my oxygen saturation, my blood pressure, my temperature, my EKG. It will record that on my phone, can learn what's normal for me, what's not normal for me, and communicate that as well to my doctor, as well as have IBM Watson embedded in this information. So we're seeing this world move quickly. They just shipped 10,000 of these as part of a clinical trial, and it's coming together quickly. Now, health and technology is also about design. So I introduced Scanadu, this company, to IDEO, a design firm, and we made this little movie about the near future of healthcare. So lights down and the volume up. Let's look at the near future as this comes together.
Technology has given us an unprecedented window into the human body. But on a day-to-day basis, we're still in the dark about our own health. We are changing that.
You okay? Do you feel okay?
What if instead of fearing the worst when you notice something out of the ordinary, you could identify the condition yourself? Getting the right diagnosis would save you worry
It says it's roseola.
and an unnecessary doctor's visit.
Rest at home. It's okay.
Instead of hearing about a viral outbreak on the news, imagine you got an alert that was tailored to your family's needs. It would also give you advice about what to do next. What if you had a way to identify what was wrong right away?
It says it's 103.8.
A way to get all of the information you need to understand the situation. And in serious cases, you would know when and where to seek help.
It recommends taking it to the urgent care.
We're building a way for people to check their bodies as often as they check their email. It's all possible, and it's only the beginning.
Now, I know many of us check our email way too often, so that might be a challenge, but technologies like this will be in our hands within 1 year. 10,000 of these shipped this month as part of a clinical trial that was crowdfunded, a whole new model for funding new innovations. Crowdfunding on Indiegogo and Kickstarter is a really new way of democratizing innovation as well. So watch this space. So part of this technology is that it's not just individual data, it's how we're connected as societies, as families. Our social networks are actually really important in understanding our health, whether it's obesity or depression. Our friends' impact ourselves. And so we're now learning, particularly because most of our health problems are not from our genetics, they're from our behaviors. What if we could start to change behaviors in smart ways? There are now companies like Omada Health that take folks who are pre-diabetic, about to become type 2 diabetics, puts them into a social network, connects them with scales and devices, and can turn them around from becoming diabetics. So that's prescribing an application to do what used to take physical meetings and lots of other effort. I think you can integrate culture. Of course, it's very different if you're in San Francisco or New York or Abu Dhabi or Dubai. Sometimes you can use other elements to instigate change. And a friend of mine from Dubai developed this system for children. So thinking about how to use new modalities or new visions of the future. If you could look in the mirror in the morning and see future you went on that diet, that might encourage you. But if you keep eating unhealthy food, maybe you could see future you. That might change your perspective a little bit. And there are new applications to look. For example, here's me before and here's me after eating 1,000 donuts, for example. You know, that changes my thinking about my diet. Or if I'm talking to a young woman who's smoking and I can show her what her skin is going to look like on her face if she keeps smoking, that can institute change. Or if your children are spending too much time on Facebook, things can happen. So looking into the near future using technology can be very powerful. And there are new technologies, augmented reality, for example, which is enabling that. You can take a demo outside in the main hall of Oculus Rift. It's an amazing way to see the world. And there are now low-cost technologies as well that enable you to put that on. I have a version right here you can pick up outside in the demo area and put your smartphone inside of this and have amazing augmented reality experiences. And this will be useful for education, but also for training medical students to learn anatomy or do surgeries. We're going to see these sorts of technologies disrupt education, healthcare, and beyond. So watch this space and try it yourself if you haven't. All right. And as you heard from Microsoft a couple weeks ago, they're developing the HoloLens, which will add a whole nother layer to our environments and can be useful for nurses, for doctors, for patients to interact with their environments. There's telepresent medicine now. I can go visit a hospital across the world in a robot and see patients. You've seen robotics play a role in surgery. Here you have Intuitive Surgical at some of your hospitals. So robotics is starting to play an interesting role for telepresence, for visiting patients and friends and family. It's playing a role in enabling the disabled who may not be able to move as well. So we're seeing new ways to, for example, take a patient who has quadriplegia. She is now paralyzed from the waist down, and just with a chip on her motor cortex, it's called brain-computer interface, she, by thinking alone, is now able to control this robotic limb. And this was a couple years ago. The new version is smaller, it's underneath the skin, and this is going to be changing the way the disabled, the severely disabled, interact with the environment. That's a form of brain-computer interface. But today, you can also buy your own forms of brain-computer interface. I have in my pocket a little headset here. It's on the market now. It's called the Muse headset. I can wear this headset, and it's going to look at my brain waves. Now, this could be fun. I can use this to relax. But we can also use these headsets to train children, for example, who might have attention deficit disorder, to learn to focus. And these have been studied in Singapore. Children can come off of Ritalin, the drug for attention deficit disorder, by learning how to use these sorts of technologies. So I think we'll see mindfulness, meditation, for example, now becoming connected to these sorts of devices and useful in many powerful ways. Robotics, again, now can be connected to these devices. So, for example, someone who's paralyzed can actually wear a robot. These are exoskeletons, a company called Exobionics. And in this example, this woman is actually, turn the sound down. This woman is wearing an exoskeleton, and parts of it are 3D printed to match her own anatomy. So that's pretty incredible combinations of 3D printing, robotics, and brain-computer interface. Now, we want to cure spinal cord injury. We don't want to treat it with robotics. The gentleman on my left there won the Nobel Prize in Medicine 2 years ago for developing induced pluripotent stem cells, the ability to take a skin cell or a blood cell from any of you and turn it into your own stem cell line, which means we'll soon be in an era where we can rebuild our bodies in new and interesting ways through regenerative medicine, my specialty. That's also combining with the technology of 3D printing. Many of you have seen 3D printing. It's becoming pretty incredible. We just sent a 3D printer to the space station, some friends of mine. 3D printing actually has very interesting applications in healthcare, whether it's neurosurgery to make a plate that matches the patient, a prosthetic limb that matches the one that's missing, if you had a fracture, to have a cast that matches your own arm. We're seeing versions that can be built for your own personal knee or hip if you need orthopedic surgery. So many examples of 3D printing entering healthcare, even ones that can be used to plan a surgery and perform a surgery with incredible outcomes. And today, using a Microsoft Kinect and a low-cost printer, you can print yourself. That's a miniature version of me. I usually have them in my pocket. And that's kind of fun, but it also could be used to treat a cancer patient who's missing part of their face by making a personalized prosthetic. So many applications of 3D printing, blending with biology, will eventually lead us to the ability to make simple organs. We can make tracheas and bladders today, and soon move to a world where we can 3D print kidneys, hearts, and livers, more complex organs. So that's part of this integration of fast-moving technologies, and governments play an important role in funding this sort of research, setting the right regulations and incentives, and bringing this technology to reality. So one of the reasons I'm here today is I am on the founding faculty of Singularity University. You met Peter Diamandis, the co-founder of Singularity here last year. And what's really interesting about Singularity University, it's based right in Silicon Valley. We have 10-week programs and 1-week programs where we ask, how do we bring smart people together, like yourselves, to learn about all these technologies and how do we apply them to grand challenges, poverty, education, healthcare, environment, security. And every summer, we have an amazing program. It starts in June. We've seen a lot of inventions come from our students. Some of our students were the first to propose using drones to deliver drugs and vaccines in the developing world, a company called Matternet. You just here, 2 days ago, announced the winner of the Drones for Good competition. I think that's an incredible example of where drone technology is going, which can be applied in healthcare. And just to show you how amazing this technology is today, I just ordered on Amazon.com for $25, a little demo, little demo. This could be used for healthcare to deliver your drugs and vaccines and do other fun things, but I'll leave it for that. So that's just, you couldn't have bought this for $1 million 10 years ago, and now it's $25 on Amazon. And those things are being applied to healthcare. Low-cost diagnostics, mobile gloves that can do exams, some of the inventions that came from Singularity University. And every year, I lead a conference. It was called FutureMed, now it's called Exponential Medicine, where we bring leaders and innovators and doctors all together to think about where technology can take healthcare, and hope some of you can join us again this November at Exponential Medicine in San Diego. A few other closing elements. The future of health, medicine, education, and beyond isn't always done by the experts. It's often new thinking, new people coming together from different skill sets. Whether it's social networking, data, finance, apps, 3D printing. Even Google's getting back into healthcare. We're seeing governments now develop hackathons. In Washington, D.C., health.data.gov, our United States government has opened up the health data, and they're having health hackathons every summer. There are new incubators and accelerators that match doctors and nurses and medical students with engineers and business people to innovate. And it's even bringing designers into the mix. Apple, and we'll hear from Steve Wozniak later today, brought design thinking to computers. And that kind of thinking is needed as you build the cities of the future, the hospitals of the future. Even something as simple as a cane can be integrated with design thinking. And some of my favorite examples about design thinking come from flying. I've been a pilot for 20 years. And if you think about it, tomorrow I'll fly home on a beautiful airplane. And the airplane I'm flying back on is Emirates. And the new A380 has a lot of amazing design elements in it that makes the flying experience really incredible. There are other 380s from other airlines, but this one's special. Why? Because they integrated design thinking. And there's lessons from both design and aviation that we can apply to healthcare. I've been a pilot since college. I learned in Cessnas. I've been in the US Air Force for 15 years as a flight surgeon, as a doctor who takes care of the pilots, so I have a lot of time flying in F-16s and F-15s. And there's lessons we can take from aviation and military that we can take to healthcare. One of them is the famous checklist. Checklists we use in the cockpit, we're learning to use those in the operating room and the clinic to make things smarter and safer and more personalized. So just like we might use a checklist on the space shuttle, we're now developing those for our operations and for our nurses and our patients, and for you yourself as an individual. We're taking the world of simulation, which has actually been developed partly here in Dubai in many forms, to take the lessons from the aviation simulator to the medical student, to the nurse, to the dentist. So they're not just seeing the patient for the first time and trying it. They've trained many, many times on this. And that can give you new skills for an individual procedure, but also help new teams come together, because many medical mistakes, just like flying mistakes, are when the team, the pilot, the co-pilot, aren't communicating well. And so at Stanford, we have an amazing simulation center that helps educate medical students and train physicians to come back and learn every year. How about the way we see our data? One of the challenges in flying, as in medicine, is there's lots of data. That's the old cockpit. Now we have a glass cockpit where this information comes to us in an integrated, smart way. And that can give us situational awareness, meaning if you're in the cockpit or in the hospital, you can use this data in smart ways. In fact, Lockheed Martin, who makes fighter planes, is now helping Johns Hopkins make the next generation intensive care units. And there's many examples of bringing that data to the doctor, to the nurse, to the Ministry of Health, so you can see what's happening and help adapt and be smart about where you're flying. So in the fighter pilot world, we use heads-up display. We need different information if we're in a dogfight, or if we're flying in bad weather. And sometimes the plane even talks to us.
Altitude.
Tells me to pull up altitude. Other cues, they're not all visual. And again, we need different data if we're in a dogfight or flying in bad weather. So this sort of sensibility, this dashboard is coming to our cars, it's coming to our homes, it changes our behavior. When you see that you're speeding or that you're getting low gas mileage, you might change your behavior. That can come to healthcare. And we're going to have new dashboards that are going to guide us both for prevention as well as for treating disease. It'll be, Daniel, go right to the gym and do some exercise and not left to the McDonald's, right? We'll have new ways of helping guide our path. The trick will be not to be overwhelmed by this information. We need to make sure it's useful and integrated. And technology from the flying world, from cockpits, is coming to our biking helmets. It can track our physiology. We're seeing examples come to our contact lenses, and artificial eyes are being developed today to enable the blind to see. And for those of us who are lucky to see the world normally, we can now augment our vision. Google is not only developing contact lenses for measuring blood glucose, but contact lenses that will port the internet directly to your eyeball. And of course, Google famously recently developed Google Glass, and Glass is, the question is, will it be a success or not? This is still very, very early versions of this technology, and one of the best use cases is actually in healthcare, where the physician or others can see the world in powerful ways, whether it's the information about that individual patient or in the operating room to understand what's happening to that patient and get information back, to be connected to IBM Watson to ask smart questions. We're seeing many uses of this, even though this technology in its current form may not be the commercial success. And that will give the surgeon or the nurse data in real time. It's going to give the patient information about the drugs they might be taking, or how to manage their disease, or even their diet. What if you see your breakfast one way, and now you see your breakfast in a new way before you eat your unhealthy breakfast, and maybe you even have another warning before you dive in, just like an airplane.
Pull up, pull up, pull up,
Sorry about
pull
that.
up.
Anyway, other cues to changing behavior. Okay, last example. Radar. What if you could see other patients like you? What if you could see all the patients in the UAE or in Dubai with type 2 diabetes and how they were doing, and what was working for them or not working? Where were the thunderstorms on their path? I think we'll enter a world where we start to crowdsource our medical data. Just like with Google Maps or Waze, when you're driving, you donate a little bit of your privacy, your data and your speed, and in response, we can build, in this case, a map of Rome. This is map of Rome just been built by the driver data from GPS in their phones. And now you can see where the traffic jams are, the roadblocks, et cetera. I think we need that sensibility as we move forward in healthcare. So kind of closing this up now, as you think about how we're going to do the future of health and medicine, realize that in the past, we've been somewhat flying blind. We've had limited amounts of intermittent data. It's been very reactive. We have a whole new set of tools, new genomics, new sensors, new lab data, the crowdsourcing of information. We can take elements from our social networks. We can mine, for example, where infections are happening around the world, even in your very neighborhood, and even with your friends. You might decide who to see each day or not see based on your social network feed, which can tell you who's likely to have influenza or a common cold. So sometimes this is dangerous information, but sometimes very useful. So I think we'll all have dashboards into our data. We'll start to own our information as individuals. We'll be in charge of our health, not just our doctor. As governments and policymakers, you can set the stage for helping this technology move more quickly, to be more connected, more contextual. You can add gaming and incentives so folks do the right thing. We can use design thinking, not just the technology, but how this integrates into our daily lives. And we can move health and medicine from where it's been, episodic and reactive, to a world that's much more continuous and proactive. I think that is truly the future of healthcare and not sick care. And my last point would be, I would encourage you to start to set the groundwork where your citizens aren't just organ donors or blood donors, but they can choose to be data donors as well. They can donate their medical data, still maintaining privacy, but to speed up the development of cures for cancer, for example. Because curing cancers are going to require the blending of these technologies, taking every tumor, sequencing it, for example, integrating that with IBM Watson and other analytics, and continuing to share and hone that information as we go forward. So start to think exponentially, not linearly. Look about redefining health for yourself, for your cities, for your governments, thinking about applying the right incentives, and in general, realize that in many ways, like with my Google Glass, the technology is already here. It's just not evenly distributed. And it's up to all of us, particularly those of us who have the opportunity to shape policy and science and beyond, not to predict the future, but go out to create it. And I learned a new quote just down the hall today from Sheikh Mohammed. I think today's world is really to innovate or stagnate, and there's no more exciting era to innovate now in healthcare and technology. So with that, I'll say shukran, and thank you very much.